So today's presentation, as you know, is looking at the challenge of adolescence and what it's like for you as parents of teenagers who live with type 1 diabetes. So I want to start off by talking about this challenge of what it's like to be a teen, but importantly, the added challenge of being a teen with type 1, and then sort of shift focus a little and talk about what that's like for parents. And of course, I want to finish off with some ideas of ways that you can support your child and yourself in dealing with some of these challenges, if you have some of these challenges. So before I get into the main focus of today's talk, I wanted to answer this question, as it's one that I'm often asked, and many of you might be wondering this as well. What does psychology have to do with diabetes? So to give you some background, for some people, diabetes can cause a lot of stress, and stress can make living with diabetes even more difficult. For example, when under stress, some people find it more difficult to follow a healthy eating plan, be physically active, get enough sleep, or even take insulin as prescribed. And for many people, coping with diabetes is an additional burden to the stress of daily life, or it may just be one of the various health conditions that they're managing. And so this stress extends beyond the person living with diabetes to their family. As a psychologist, I see people with diabetes and their family who experience high levels of stress and who may need some support to cope with this. Some people with diabetes also experience mental health conditions. Depression, anxiety, eating disorders are the most common mental health conditions among people with diabetes. And while these may not be related to diabetes, they generally will have some effect on management of the condition. But I really want to emphasise that certainly not everybody with diabetes or their family needs to see a psychologist about the diabetes, and not everybody will develop a mental health condition either. But it is important to point out that some people, and many people at different points in the diabetes journey, will undergo some stress and find managing diabetes quite difficult and may need some extra support for that. So when I ask questions today, I ask you to share some of your experiences, just being mindful that others' experiences may be completely different to yours, and neither is right or wrong. It's just what it is. And hopefully we can have a good discussion about that. So let's focus now on why we're here. As many of you are aware, diabetes places significant self-care and psychological demands on teenagers and families. Adolescence can be a hugely challenging time even without diabetes. So during this period, we know that optimal diabetes care is often compromised, which can lead to early onset of long-term complications. Part of this may have to do with the support they receive as they transition into adulthood. Unfortunately, this transition period isn't as smooth as it could be, with around 30 to 40% of young people with type 1 diabetes becoming lost in transition from pediatric to adult diabetes care. They were asked whether their child's doctor or educator had talked with them about the transition from pediatric to adult diabetes services, and found that 45% of the parents indicated their child did not have a transition plan. 38% had not discussed finding an adult care provider, and 43% had not discussed how their child's healthcare needs might change as they move towards adulthood. So for teens, management of the transition from pediatric to adult care, diabetes self-management, and prevent or delay complications. Yet, as you can see, many aren't getting enough support or as much support to ensure a smooth transition. We also know that the psychological demands on young people with type 1 are huge, which, as I mentioned in the previous slide, can have an effect on how diabetes is managed. And various studies have shown that around 1 in 3 young people with diabetes are known to need mental health support. So, what is so distressing for teens? Research undertaken by the ACBRD examined the psychological and social aspects of diabetes among teens with type 1 and their parents. And just to give you a bit of an overview of some of the themes that came out of this study, they said the pressure of keeping it all together, feeling different to everybody else. Every day is a struggle socially, mentally, and physically. That things can frustrate me, make me angry, confuse me when my levels go whether high or low. How annoying it is to be constantly pricking yourself in front of everyone and they just stare at you. It's really embarrassing. So I guess I want to know from you, does any of this sound familiar to you? Is there anything new here or anything surprising? If you wanted to make a comment, just pop your hand up and we can bring the mic around to you. Anything else that you've observed in your own teen, perhaps? Everyone's going to be shy. Is this not at all your experience? Pop your hand up if it's not. Oh, no? No? Okay, we'll bring the mic to you.
Okay, there you go. One that mine comes up with, I don't have the time to test mum. I've got to get from there to heat the food to get to where my friends are, otherwise they're gone.
Mm-hmm.
And that's been a big issue for several years now. So as a consequence, she doesn't test. Even though she's got every piece of technology going, she doesn't do a blood test before food.
Yeah, so there's a lot of mental effort involved in looking after it and
Being left behind.
yeah, so being left behind.
Sorry, friends disappear off. Good friends, so nice people, not horrible people. Just move on.
When you're teens, you're figuring out your friends and, who you want to be around and trying to fit in. And diabetes is another thing that kind of makes that really hard to do. So that's kind of annoying that you have to think about it all the time.
Okay, something I actually got this morning was, Mum, why are you dragging me out of bed at 7 a.m. and forcing me to go to a summit? And just because I've got type 1 and all the other kids have got type 1, it doesn't mean we're going to be friends and get on with each other. I'd rather be at home. And I know what I'm doing.
Yeah. So that's a good point that, it's true that just because they have type 1 doesn't mean that they're going to instantly connect with everyone else that has type 1. They are their own people as well as having type 1. It's not their whole identity. Mm-hmm. Did anyone else want to make one more comment before we move on?
I'd just like to say that
That's good.
I'd just like to say that when you tell your teen about the complications, you get the I don't care.
Mm-hmm. Do you think that's true?
No, but
Okay. Yeah, but that's the response you get. So it's really tough for you when you're trying to help and, best intentions, but there's a bit of resistance on their behalf because maybe they just have other things that are more important to them right now, like friends and fitting in. So it's really common for people with diabetes to feel a range of emotions about their diabetes. So some of the issues you've brought up, so, some of this, just wanting to fit in and kind of not prioritising it right now, but that they care about it. It's just that perhaps, there are other things that are more important for them at this stage. But other emotions as well, like what some of these teens have said, anger, frustration, embarrassment. So these are all common experiences at some point. And what I'm describing here is what we call diabetes distress. So it's the emotional response to living with and managing diabetes. So there's always going to be an emotional response. And so A mild degree of that is normal. It's part of living with diabetes. Of course, at times it's going to be frustrating or annoying, and it will fluctuate over time. So there will be particularly more challenging periods for them, early first diagnosed, or changes in treatment, or other life stress, things that are going on in their life that make diabetes just another kind of burden for them. However, when this distress becomes severe, then that's when it can be a bit of a problem, and that needs to be addressed. So I'll explain what that means a little bit more. But first, I just wanted to show you some stats. So in over 700 young people with type 1 who were surveyed about diabetes distress, around 1 in 5 of them indicated that they experienced what's known as severe diabetes distress. So this means that their emotional response to their diabetes goes beyond what's considered normal. So it's when this starts to have a really big negative impact on not only the way that they manage their diabetes, but also other aspects of life too. Can have an impact on social, schooling, all sorts of things. Girls typically report poorer emotional well-being and quality of life as compared to males, and girls tend to be more distressed about their diabetes, specifically when it concerns food and eating. So why is this a problem? Well, we know that this continuous high level of distress is problematic because it's associated with elevated HbA1c, less frequent blood glucose checks per day, even skipping insulin doses more frequently, and can lead to disordered eating behaviours as well, particularly among girls, but not exclusively. And for some teens, this can lead to what's known as diabetes burnout. So diabetes burnout is defined as a state of physical and emotional exhaustion caused by the continuous distress of diabetes. So some of the signs of diabetes burnout include disengagement from their self-care tasks, unhealthy or uncontrolled eating, risk-taking behaviour, and non-attendance at appointments. So sometimes this can result when a teen feels they have too much responsibility when it comes to their diabetes, but it's really important to recognise that burnout is quite serious and something that requires professional help with. It's not a form of rebellion. They generally do care about their health and their diabetes, but sometimes it just gets a little bit too much for them with everything else that they've got going on. It's also really important to distinguish diabetes burnout from disordered eating behaviours or an eating disorder. As I mentioned earlier, one of the biggest concerns for teenage girls with type 1 especially is around their weight. And some of the signs of burnout can mask what is actually a severe mental health condition, such as an eating disorder, which often involves purposely skipping insulin to lose weight and uncontrolled eating. And again, this is a very serious problem and does require immediate attention from a qualified health professional. So you might have noticed in this list, I've got risk-taking behaviour as a sign of diabetes burnout. Does anybody know what I mean by this? Any ideas? Yeah?
I guess that eating lots of food but not taking your insulin just to see how far it goes, and vice versa.
Okay.
Doing lots of exercise to see how low you can get without going into a hypo, maybe.
Okay. Yep. Any other ideas? Thinking more generally as well. So just as teenagers, some of the risks that Fiona just over here, risks that teens might engage in.
Drugs and alcohol.
Yeah, so they're really big ones. So drugs, alcohol, smoking, these are all, risk-taking behaviours that, if your teenager is engaging in some of these things, they're probably normal. Has anyone here never taken a risk as a teen, tried alcohol, or put your hand up if you never did? Yeah. So these risk-taking behaviours, it is important to try to distinguish between what is actually them just being a teenager and what's them feeling burned out by the demands of their diabetes. So it's often thought that teenagers engage in risk-taking behaviour because they're not very good at evaluating risk, but this isn't actually true. More recent research suggests that peer relationships have a lot to do with whether teens will engage in risky behaviours. So for teenagers, and as some of you have pointed out already, there isn't a real increased interest in their peer relationships, which is true for adults too. But because this part of their brain that's involved in self-regulation is still developing when they're teens, they become far more distressed than adults do when they are excluded by their peers. So they're not so effective then at managing the distress during social exclusion, which is likely contributing to them taking more risks to prevent being excluded by their peers. So peer relationships are very important at this stage of life. No teen, diabetes or not, wants to feel different. They are trying to fit in. And when they do feel different, it really hurts emotionally. So coming back to what the teens had to say in that previous study, a lot of it had to do with this sense of feeling different from everybody else and fear of being excluded in some way that's contributing to their distress. So diabetes is just adding another thing for them to feel self-conscious about. So up to now, I've talked all about some challenges of what it's like to be a teen with type 1 diabetes, but now it's your turn to be in the spotlight because, as I mentioned at the start, this is also a challenge for people who support those living with the condition. So instead of me listing all the things that may be challenging for you as a parent, I would like to know what are the most challenging aspects of parenting a teen for you. So just pop your hand up if you'd like to share.
Mum of a 14-year-old boy who's had diabetes for 11 years.
Mm-hmm.
There's enough to nag about being a parent, and you just don't want to nag all the time.
Mm-hmm.
Have you tested? Have you bolus? Is it time for a pump site? And it's finding that fine line between supporting them to manage their diabetes, but not nagging too much or not feeling like the diabetes police.
Exactly. Yeah. So the diabetes police, is that something everyone's heard of before? So it's this sort of feeling like you're being too controlling or critical or nagging when you're just trying to help.
And just helping them support that burden of living with a chronic disease when they're so young and they just want to be like their friends. That's the dilemma for me.
Absolutely. Yeah, and I think that's a really common one. Yeah, thanks for sharing that. Does anybody else have anything else that is a real challenge for them?
Diagnosed at 17 last year, and alcohol.
Mm-hmm.
That's a real challenge to be a newly diagnosed and then also factor alcohol in as well.
Yeah, absolutely. So how do you manage that with, they're underage as well, so that's tricky. And then, obviously they have to take care of themselves, and that's a real challenge for a lot of older parents of teens in particular. Mm-hmm. What about things like worrying about hypos when they're asleep? Mm-hmm.
That's actually my biggest fear,
Mm-hmm.
to the point where, Maddie was diagnosed when she was 7, she's now 13 and she manages everything on her own. But we actually run her a little high at night, just hoping she doesn't go into a hypo. And at our very last quarterly appointment, it was very sobering to be told that, you can't be comfortable when she's 9 or 10 at night, because that's terrible. She has to be between 4 and 6 before she goes to bed. It's like, I don't think so. And then sobering again to be told that, if you don't do this, you're not doing her any favours. And she's sitting there saying, oh, but isn't there going to be a cure in 5 years? That's what I was told when I was diagnosed.
So you're getting blamed as well.
Oh yeah, it was very sobering. We went for Yumcha after just to get just to sort of
that's a lot of
pamper
pressure.
ourselves. Yeah, it was a lot of pressure. And she said, I just don't want to go back.
Yeah.
Because of that, diabetes police and so on. And we listened to a woman this morning who said she didn't want to go because she was, judged. Or it was kind of, and we'd never been in that position before, so it was very sobering. But to finally learn that it's not good to go to bed at 9, when we thought that was good, single digits is great. And so, you have to try and go to bed even if you're at 5 or 6 and not have some milk or not have anything is very scary for us. So
absolutely.
we have to try and work through how we do the flash monitoring or whatever we need to do, so we know exactly where she is all the way through the night, so we can be comfortable with being low before going to bed.
And that's a really common concern for parents is worrying about hypos.
So the JDRF newsletter just released a comment about someone who passed away, and our first thought, and I'm sure every parent's thought is, wonder if they died in their sleep because they were too low. So it is. And it's interesting because the endocrinologist that day who sobered us up said, look, got to get over that fear, got to be low, between 4 and 6 and don't worry about it because it's everybody's fear. But as a parent, there isn't a day that I live without that fear. And there isn't a night that I go to bed thinking, will she be fair, breakfast in the morning.
Thanks for sharing that. And it is a really common fear for parents to have. And, having an endo, trying to, they're almost being the police to you, and then you've got to be the police you don't want to be, but comes across like that can be really challenging.
I think I share your fear as well. And we've got the Freestyle Libra, which we can scan while she's asleep, which has been very handy. I don't get to single digits before she sleeps, to be honest, so 9 or 10 is good. And that's a big problem because we have such a fear. And without a doubt, if she goes to sleep before at about 7 or 8, she will drop to 3. Exactly. So I don't know how to resolve that problem.
Yeah. Thank you. So there's a lot of pressure coming from the healthcare team, and then, you've also got your own pressures of worrying about their well-being, and so there's a lot for you to think about as well. So it's not just them kind of thinking about this all the time. And then there's the issue of wanting them to have their independence as well. So you want to care for them, obviously, but not overcare. So there are many aspects of parenting a teen with type 1 that can be distressing, as some of you have pointed out. And diabetes distress isn't just something that the person with diabetes experiences. Distress resulting from the burden of diabetes extends to parents. And interestingly, in that same study that I mentioned earlier, the rate of severe diabetes distress among the parents was comparable. So 18% of parents of children aged 10 to 19 years reported severe diabetes distress. And again, females had more concerns than the males. So this is important because your mental health really matters too. Your well-being is important. Parents of teens with type 1 are at an increased risk of anxiety and depression, and this can impact not only on your own well-being but of course, on your families, on your child's too. So that's why it is really important to address any of these concerns if you have them. So like I said earlier, a mild amount of distress is common and is normal to an extent. But when it gets to that severe level, to the point where, you know, you're not sleeping at all at night because you're so worried or you're so afraid of something going wrong, or it's really impacting on your daily functioning, then that's when it really needs to be addressed. So in the same study where the teens were asked about some of their distress, parents were also asked about, you know, what it was like for them in living with this. And so these are some of the themes that came out in that particular study. We feel stressed and unsupported outside of our medical appointments. It's very difficult to let go and allow him to manage his own diabetes care now that he is 18. We constantly worry for our son's future health. It's a constant struggle and juggling act. How exhausting and constant it is for my child, but for us as a family too. And I wish people knew that type 1 is not caused by lifestyle. Does any of this sound familiar? Anything unsurprising or anything, surprising or anything, that you haven't experienced before, or something different that's not there? So it's pretty consistent with what you've all experienced. So there's lots of aspects of diabetes that cause distress in both teens and parents. And these statistics were drawn from the Diabetes Miles Youth study, which was conducted by the ACBRD a couple of years ago. And a copy of that study report is freely available on this website if you're interested in having a read. So they surveyed teens and their parents about various psychosocial aspects of living with diabetes. So things like depression, anxiety, diabetes distress, eating problems, social problems, all sorts of things. And so this table shows us the most serious problem areas, or what's sort of most distressing when it comes to living with diabetes for both teens and their parents. So I'll read through some of these now. So feeling that my friends or family don't understand how difficult living with diabetes can be is the most, according to this study, the top problem area for teenagers. Worrying about my weight, and as we know, that was more prevalent for the girls, but still can be an issue for boys. Feeling upset when my diabetes management is off track. Worrying about the future and the possibility of serious complications. Not feeling motivated to keep up with my daily diabetes. So these are what the teens are saying. These are some of the issues for them. So, even if they may come across as like they don't necessarily care, a lot of them, most of them do. And there's lots of aspects of diabetes that cause distress for them. When it came to the parents, the top problem area for them was worrying about the future and the possibility of their child developing serious complications. Feeling upset when my child's diabetes management is off track. Feeling like I act like the diabetes police. So we've talked about that already. This is a really common concern for parents. Feeling that my friends or family don't understand how difficult living with diabetes can be. So similarly to teens, needing to feel understood is really important. And feeling sad that when I think about my child having and living with diabetes. So these are really common things that I hear from people in my practice as well, and some of the things that you've shared with me today. So we've covered the challenges, but now let's look at what you can do to support your child and also yourself when it comes to living with diabetes. So the first point, and something I touched on very briefly at the start, was around transition. So supporting your teen's transition into adult diabetes care is quite important. The NDSS have developed a great resource which is freely available on their website about transitions not only into adult diabetes care but also into independence as an adult. For example, driving, going to uni, using alcohol, and a whole range of other aspects of life that typically come with adulthood. So you might like to talk with your teen about the resource when they're around. So it's developed for 16 to 18-year-olds, but you might just like to read it for yourself because there's some useful tips and strategies in there. So being aware that your teen may not feel comfortable discussing some of the issues with you or any of the issues with you, and that's okay. I suppose if they don't want to talk with you about it, encouraging them to discuss any concerns they have with someone they trust is a really important strategy for you. And of course, every relationship is different. So some will want a more hands-on or hands-off approach, which is fine. So just finding what works for your family is most important. And knowing that they're getting good healthcare may help to lessen some of your worries about their health in the future. So complications are not inevitable and they can be prevented. Supporting their transition may alleviate some of your own worries. JDRF also have a great resource called the Team Toolkit. Marella, did you want to talk about that now? Yep.
It's available to be downloaded.
Just get the mic, sorry.
Sorry.
Yep.
I should know that. I'm teaching. It's available to be downloaded on the JDRF website. This is a toolkit for parents. It talks about a lot of the challenges that Adriana's spoken about. If you would like just to even go to the JDRF booth, we can actually send you out a hard copy if that's more your style rather than downloadable resource. So it's been put together by a number of experts and for Australian parents of teens with type 1. So a really good read, not front to back, but there's lots of information about risk-taking, alcohol and how to manage that, learning to drive. So some great tips for parents.
Thank you. So in terms of managing the more psychosocial issues that I've touched on today, I guess being aware, and I know I'm sure you all are, that being a teen is hard, but throwing type 1 diabetes into the mix is pretty tough. And as you saw in that table, a large proportion of teens feel that people just don't understand how hard it is for them. So communication is so important, letting them know that you're there for them. And one way to do this is to validate the way that they feel about their diabetes and be open to have a conversation with them about it. Again, remembering they may not want to talk to you about this, and that's really important to respect that if they don't want to. But showing them an interest and being open to hearing that, open to hearing whatever it is that they have to say will give you the best chance of communicating effectively. A helpful strategy can be to try to use more open-ended questions when you're eliciting a response from your teen rather than kind of closed questions. So questions that will allow them to elaborate. So how did that go for you? So forcing them to kind of give you a more than one word answer can be helpful. It might take a little bit of planning out in your mind beforehand, but with a bit of practice, it can be really effective. So just sort of validating whatever you've observed that might be really tough for them, and then perhaps following up with a question to allow them to express how they feel. And it's really important to listen to their response without necessarily jumping to give them advice or a solution to their problem. Sometimes all they want from you is just to be heard. So if you're unsure about that, perhaps asking them what it is that they might need from you, so checking in with them. Of course, sometimes problem solving together is absolutely important and necessary, and they will want your advice. But other times it is just really important to allow them the space to express whatever it is they need to say. This one's obviously a little bit tricky. Avoid lecturing. Can be difficult to do, especially if you're feeling frustrated and worried about their health and you can clearly see what they need to do. But lecturing them is not going to give you the best outcome. So telling your child off for not staying on track with their diabetes care is not helpful and can lead them to feel like they failed or let you down. And it can perpetuate that sense of people not understanding how hard it is to manage their diabetes. So refraining from words like you should be checking your blood glucose levels or why haven't you taken your insulin. So these sorts of words imply a lot of judgment and they can reinforce feelings of guilt and a sense of failure. They can have some longer lasting effects on how your teen or your child, their sense of self and impact negatively on the way that they manage their diabetes into adulthood. For example, if they feel like they're failing, then they may stop trying, may give up caring about it. So instead, try to use statements like, I think it's important that you take your insulin. What stopped you from taking it today? So using that open question to be a little bit more curious without being judgmental. Or I can't imagine how frustrating it must be to have to test your blood glucose levels every day. But I also think it's important that you check, is there anything I can do to help? So you're not kind of letting them off the hook, so to speak. You obviously want them to be responsible and take care of themselves. But it's just the way that that message is delivered can have a huge impact on the outcome. So feeling guilty and judged is not motivating at all. So if anything, it will make it harder for them to achieve their goals. So always reminding yourself of what your objective is before commenting. You want the best for them. And as we saw earlier, you don't want to be the diabetes police. So simply reframing the way that you communicate these things can make a really big difference to the outcome. It's really easy to get caught up in the outcomes. You know, the healthcare team have likely given you ranges to aim for when it comes to their blood glucose levels. And while this is important, this number doesn't tell you a lot about the person. For example, it doesn't tell you what your child needed to do to get that optimal HbA1c. Perhaps they had to have multiple hypos, or they didn't play the sports that they enjoyed because they were fearful of having hypos, or they felt distressed because they were skipping social events to manage their diabetes so tightly. If you focus on these numbers too much, they may feel, and that this is an important reflection of who they are, and of course it isn't at all. So avoid using judgmental words like good and bad when discussing blood glucose levels. The problem with using these kinds of words is that they won't always have what's considered good outcomes. And so if every time they have a so-called bad outcome, they will likely feel guilty and may start to interpret this as, you know, I'm bad, I can't do this, I failed. So instead, focus more on their behaviours and encourage them for their efforts, regardless of the outcome. So, you know, I know you didn't get the outcome you were hoping for, but it's great that you checked. And then at a later time when the emotions aren't so high, perhaps brainstorm ideas together about what they can do in the future to manage their blood glucose levels. This also applies to food and eating and weight. As you saw in that table, a large proportion, especially young girls, but not just girls, worry a great deal about their weight. And there is a lot of emphasis on food and eating when it comes to diabetes, and being a teenager is an especially vulnerable time for feelings of low self-esteem, body image issues. And it is a time when eating disorders typically develop. So it is important to be mindful of their relationship with food And again, just refraining from using good or bad terminology for those same reasons, that it tends to imply a bit of guilt, judgment. So for people with diabetes and a mental health condition, it's really important to seek support of a psychologist who understands this complex nature of diabetes. So this will aid in the treatment of the mental health condition. If you notice signs of a mental health problem, it is really important to encourage them to seek support. I also wanted to, I'm just mindful of time, so I'm going to get through this next couple of slides quicker than I expected, but hopefully I've covered a lot of this already anyway. But the social world is hugely important to them at this age, and this is part of their mental health too. So, some of this will come down to trust and letting go of some of your worries, which of course is really tough, but it is necessary for them to still do things that are enjoyable and socially rewarding, which just may involve setting some boundaries with them about what is and isn't appropriate. And if there is conflict around that, then perhaps it is worthwhile speaking to a psychologist to come to agreement on some of those aspects. And I've just got a link there to the JDRF directory. So connecting with like-minded individuals through things like peer support and diabetes camps can be highly beneficial. So, they may not need to see a psychologist, but just talking to someone who really gets it, someone who really understands what it's like for them will be incredibly valuable. So if that's something you've considered, then have a look at that link. And just lastly, it's really important that you take care of yourself as well. So you can't pour out of an empty cup. So if you've noticed that this is becoming quite burdensome for you, quite distressing, it is important to talk with somebody, whether that's a trusted family or friend or a health professional. Even considering joining a peer support group or an online community yourself. And again, JDRF have on that link some information about where families can access those sorts of programs. So just to summarise, most teens and parents have good quality of life and emotional well-being, but there is around 1 in 5 teens and 1 in 6 parents who do experience severe diabetes distress. And this is something that needs to be addressed within the healthcare team. And there are lots of things that you can do to help reduce your own distress and to help reduce your teens' diabetes distress as well. So thanks very much for listening, and that's all for me today. So I think we'll do the Q&A now.
Thanks so much, Adriana. That was fantastic. Can we give Adriana a very wide... Adriana, I've got one to start off with. It's really cool to say, we seek psychology but support, but do I go to the yellow pages? How do I find somebody that is expert in diabetes? And what about if I'm in rural or a remote area? What can I do?
That's a good question. So finding a psychologist who has expertise in diabetes isn't the easiest thing to do because there aren't many of us. Finding someone in your area who you can connect with and trust is very important. So if you're looking for someone who is local, looking on the Australian Psychological Society website, so you can search for psychologists. They have a website called Find a Psychologist, and you can search based on your location, how far you're willing to travel, and also some skills. So you may find that there is someone in your area who has diabetes listed as one of their interest areas. In terms of rural, remote areas, that's a tricky one because there's not a lot of services, generally speaking, and then throwing into the mix something a bit more specialised. So talking to the diabetes healthcare team is the most beneficial way of accessing that kind of support. I do offer an online service, so that's something that has helped some people who live in rural areas who just, can't get to the city or other services. So that's another option that helps some people. But I'd say talking within the healthcare team and seeing if they have recommendations.
Awesome, thank you very much. And we've got some flyers for Adriana's e-psychology service as well that I'll hand out at the end as well.
I did ask up at the hospital for, at Monash Children's actually, for the name of a psychologist, and they said you just have to go to your GP and try and find someone. And I did the search and everything, and I couldn't find anyone.
Yeah.
In the end, we ended up using, I ended up seeing a psychologist who had no idea about diabetes, but it took several sessions. But initially, she actually even just said, well, do you have to check your blood sugar overnight? So there's so much knowledge, and it's a lot of wasted sessions. It worked out fine in the end, and now she knows a lot more about it. But I can't believe there's not a list somewhere at the hospital, or even you could provide a list of psychologists that sort of do know a bit about diabetes to start off with.
That is a big risk with seeing just any psychologist. If they don't know much about diabetes, then sometimes it's maybe better not to see them at all because it can create more anxiety. But
particularly when you're going there because you're feeling like you're unsupported or people don't really understand what you're going through, and then they're sort of saying, well, why do you have to do that? Do you really have to do that?
So some of the services, the hospital services, have social workers or psychologists on their teams. I know not all of them do. In terms of private psychologists who understand diabetes, from my understanding, there's about 2 of us in Melbourne, which is why it's really tough for people and it's hard for me to recommend anybody because whilst I think it's important to see a psychologist, I understand exactly what you're saying about, not necessarily it being the most helpful thing to see someone who doesn't understand diabetes. So unfortunately, there's not a lot of services available in general. Yeah.
Adriana, do you mind if I just mention, I know if anyone's in the Geelong Always region, we have a service called the Pediatric Adolescent Support Service, and that's for all kids with chronic illnesses. Royal Children's have social workers on their team and Monash Children's as well. So they're good ones to just try to link into initially. But passing the Geelong Always were areas down there too. Yeah.
We might, from a JDRF perspective, I think that's a really great question, and we'll look at maybe doing some collation from different clinics and putting something on the directory on our website so that people can at least hone in on particular clinics that do have the social services and private practices like Adriana's. So we'll start to work on that list and add it to the JDRF website. It's a great question, and I think obviously a need. So thank you.
Thanks, Marilla. Guys, in the essence of time, we'll have one more question, but Adriana has kindly said that if anyone wants to stay and ask more questions, we can take up the first couple of rows and just stay back and ask some questions and keep it going for another 15 or so minutes afterwards. But have we got one last question?
Just if support and understanding is really important for this stage of life, can you just touch quickly on a level of school support cooperation that might reasonably be expected from the school arena? And I'm thinking like camps and those sort of things.
Yeah, that'd be great.
That one's going to take a little bit longer to do. So what we might do in the essence of time, anybody that's interested in that one, we might just come down the front and answer that, and I can support you because there's a lot going on in the school environment at the moment. It's exciting times, actually, $6 million from the government, but also a lot of angst that's going with that as well. So is that okay?
Absolutely. Yeah.
Has anybody got, can I say a quickie, for one?
Just on behalf of the lady behind there in the blue, you talked about the risk-taking behaviour. Is there any strategies that you would suggest for parents when they are starting to, touch on and go over those boundaries that you set as a parent?
That's a really hard one because every relationship is very different and every teen is going to respond differently. But I think, the points I made about open communication is so important, and, just trying to give them the space and opportunity to talk to you and let them know that you're not going to judge them for some of these things, and trying to put yourself in their shoes as well can be a helpful way to sort of foster some of that empathy for their situation. The risks they're all around them, and their peers are so important to them. So just trying to understand that there are these external kind of temptations around them, and that's a reality, but just sort of providing them with the facts and letting them know that you're there for them, and that you want to keep them safe as well.
Excellent. Look, on behalf of JDRF, I'd just like to say thank you so very much for coming here. Thank you for sharing your thoughts, and especially bringing out the fears. It's very hard to even just say that out loud, let alone in a room of a group of people. Mm-hmm. So thank you so very much. Adriana, what a wealth of knowledge you are. Thank you so much for sharing that. And, the journey in Type 1 continues. And it's really important to remember that at all ages and stages with Type 1 diabetes, that people need support. And it's not the immediate child or adolescent or adult, it's the whole family as well. Mm-hmm. So Adriana's kindly going to stay back. And Marilla, thanks very much for the opportunity.
Thank you, Pete. Just to wrap it up, there is lunch just about to be served, but if you're happy to hang around, I think that's a great opportunity to talk to Adriana and Fiona. The kids and teens program, they're back in their room, so you can collect them when you're ready and have some lunch. The afternoon session for carers of children and teens will be held in Ballroom 1. In that front room, so we'll let you know when that's happening. So thank you.
So please, would you like to say, just come down to the front. I'll hand out some of Adriana's flyers as well.
Thanks, Fiona. Did you want to answer that? Here you go. Oh, yeah.
We were just talking about Sebastian Seville. You've seen him, yeah, Nick. He's pretty amazing, very good eye candy, but he has Type 1, climbed Mount Everest, run across the Sahara. He's a pure legend, has just released a book, and he's really cool. Sebastian Seville. He's a Canadian. Oh my gosh, he's amazing, and I'm very privileged to call him a mate. So I'm just trying to get on his panel for next year if we get him.
JDRF will be speaking to him very shortly.
Oh. He's awesome, Adriana.
You guys get on with it.
Okay, guys.
So just have some lunch later on.
Great. So we've got about 10 minutes,
yeah.
Adriana. Question, schools. Can you just rephrase it? Was it schools question? Yeah. Can you just rephrase that for us?
If support and understanding is so important at this age level, school is a place that you spend a lot of time at that age. So what is a reasonable level of expectation? Yeah, for school to get on board with support. Mm-hmm. So maybe it's more perhaps when you've got the camps and that sort of thing, perhaps that's another element.
School camps, you mean?
Yeah.
Yeah, okay.
And maybe just even day to day, but what can reasonably be expected, or engaging schools, or just speak to the school scene, because it's a lot of hours in the week.
Absolutely, yeah, and that's such a huge concern.
For that age group.
Yeah. Yeah, sure.
My daughter's 15, diagnosed 3 years ago. What I've found, the camps are definitely a challenge, but I can manage that because I go and educate the school every time she goes to have a camp. What I find, or what my daughter finds more challenging, is the day-to-day. I feel my number's going low. She's getting questioned all the time about why she needs to go out. So just the general education across teachers as a whole seems to be a challenge that we have.
Yeah, you jump in.
Are you schools as well? We'll get all three at once. We'll go over.
We're all schools.
Yeah.
Thanks for coming. Yeah. We've had a number of issues. One is that they make my daughter's 15, and they insist that she go to the nurse every day to inject, even though she's perfectly capable not to, which creates social issues.
Yeah.
Because her friends have to wait for her, and sometimes they do. They're nice girls, but sometimes they do, sometimes they don't. So that's one. The second issue we've had is around exams. So she's actually doing a VCE subject, and she had a hypo in one of her exams, and I got asked why, rather than, and we're trying to put in place for her when she actually has to sit her 3-4. It's just been a battle. We've had so many meetings with the school trying to work out what she's allowed. I initially actually got told that she couldn't have food in there, and she was, of course, wasn't allowed to have her phone because that would. But it was ridiculous. I said it would be far more disruptive to have her unconscious or fitting on the floor than it will be to allow her to have food.
What's their reason for not allowing her to inject?
I think it's lack of education in the end. So we actually contacted Diabetes Victoria and the Department of Health and Department of Education. We've had to provide a lot of the paperwork to them, and we're still battling to get a lot of stuff through. So this is you would think they pride themselves on treating individuals and all that kind of stuff, and every teacher, the communication is just poor. It doesn't get through, and
Do you mind if I do part of that? And then
Fair enough.
It was very long.
Yeah. No, it's
this
good question.
is one of my major areas of passion, and I'm heading to Canberra this Friday actually to a big summit that you would have noticed that the government has given out $6 million in the last few months. And what's happened over the last month is, you may have been involved in it, that there has been Diabetes Australia they're the representative of all the organisations, has been going around getting the voices of parents, voices of teachers, voices of kids, you name it. And on Friday, it's all going to be presented and how we are going to use this $6 million to make a difference. Okay, so that's really promising, and I just want to let you guys know that. And I'm very excited. I'm representing regional Victoria, so I'm regional rural Victoria. I don't know how Geelong's rural, but anyway, we're getting there. So that's exciting. Can I just let you know what two things is that one is that if you have any issues with the schools or work, part-time employment, Macca's, KFC, you name it, not that I've had any issues with those places, but they just come to mind. JDRF, Diabetes Victoria have an advocacy team, and it's led by Susan Baxendall. She is absolutely incredible, and whenever I've had any issues with schools or anything like that, I have called her. So can you write that name down? It's probably the most noteworthy thing I'm going to say for the day is Susan Baxendall, and I believe she's working with Julie, is that right?
It's Suzanne, yeah.
Suzanne,
Julie
sorry.
Davies and Suzanne Baxendall.
How cool are they, Adriana?
Baxendall, Baxen.
If you ask for the advocacy team, they'll be put straight through.
Baxendall, yeah.
I should have written that down.
Yep, so she works in the advocacy, and it's exactly the same thing I was going to suggest is calling her and asking, she's a social worker background, and so deals with a lot of these issues. It comes up a lot, unfortunately, so you're not alone in what you're saying clearly. This is a really big problem.
Adriana, there's also, just sorry to interrupt, but as far as what are the expectations and what should be done, we are very lucky in Victoria. It's not all over Australia. If you go to the Victorian, and as parents, I want you to go there and check it out, the Victorian Department of Education, and have a look under diabetes. There is a whole section there of what is the school's responsibility, what they should do, their duty of care. It even says what they should be doing on camp. So for the younger kids, it would be about are they able to be taught the 6 months prior being able to give injections, or do parents go? The older kids, what to do as well. It's extremely detailed. Just don't do a Fiona and flick through. Actually go through and go into the links, and you'll find it is unbelievably detailed. Exactly what you were saying is what should they be doing? What level of care? What is the responsibility? It's all detailed very well in the Department of Education Victorian under diabetes.
So what about independent schools?
Say again, sorry. Look, it's really interesting. There's nothing for your private schools as such, but they all refer back to these guidelines. So, if you're an independent school or a private school, you don't want to be seen to be doing a less supportive job than the public arena, do you? So, so we're finding that. What I have found with independent schools is that they actually sometimes purchase a nurse. They actually hire a nurse to go on some of these 10-day challenge camps down the Otways and things like that.
But you say that there's guidelines, but if they're not following those guidelines, which clearly a lot of them are not from our experience, what can we do?
Yeah, absolutely. So one of those things is to contact the advocacy team, and that's probably my priority. If they're not doing it, I'd talk to your diabetes team, because your diabetes team have got a really good voice as well. And sometimes it just takes, I would probably talk to schools maybe twice a week. And often it's not that they want to be a pain in the butt. It's actually that they don't understand and fully understand that really, you know, with some support, it's not as scary as what they think. Different hospitals will offer different programs for teachers as well.
You know, ignorance is our worst enemy. I reckon,
Absolutely.
I reckon everyone has the great intentions, but they just need the education.
Absolutely. And I think sometimes it could just be a member of the healthcare team or to say, ring a school and say, what can I do to support you to get this child on camp?
Definitely. I think, you know, your healthcare team will be more than happy to write a letter or give them a call, or, you know, I certainly do that all the time, and schools are very understanding when you talk to them.
I get what everyone's saying. I just think that no one's going to know your child's diabetes more than they are, and having the teachers empowered rather than scared. So I've just, my experience is that some parents will go into a school and scare the living daylights out of the teachers about, you know, the risks of hypo and unconscious hypo, and my kid's not going to wake up in the morning, and or they're going to go high and they're going to get ketones, and this is what you have to do, and all of those really worst case scenario. And it's absolutely important that the teachers are aware of those, but it's more about not scaring them. I think the teachers are going to support your child better if they're confident that your child knows how to do that, because they're going to be the best people to be able to manage with your support and education, and knowing that they can be contacted on the phone, and yes, I'll guide them through that. That happened to my son, first year 7 camp. He can manage independently. He wore a pack. The pack rubbed his pump side off. He replaced it. It failed. So at midnight, I'm on the phone, and he's got ketones, and he gave his first injection because he'd been on pump the whole time. He managed it really well, and we'd already practiced that before he got there. But that, I didn't tell the teachers that was the worst case scenario, and we've just faced it. I just went, yeah, we've done it, and he's managed that, and it's all worked out, and now he knows he can do that. So we learnt from that. Don't carry a pack on your pump side, you know. But it's about empowering rather than scaring.
Yeah, that's definitely a good point. So working as a, you know, making it as that you're working as a team, including the child as well in that. So, you know, they know it the best, like you say. So trying to, I guess, make a plan if you can with the school. I've just got one over there, and then we'll come back to you.
Oh, sorry.
No.
Just very quickly on camp and educating teachers. This is an independent school. My daughter was running high and at one point vomited overnight because it wasn't feeling well, but they had been managing hypos, and what they did was, and this was a nurse with the teacher, is feed her heaps before she went to bed because she was low, and the problem was then she ran high and then vomited. By morning I got called by the principal to collect her from Woolpool. But it's about that empowering rather than fearing. So they just got scared because she vomited. But my fear now is this girl really wants to be like everybody else because she's 13. She's no longer 11 when this happened, and could, you know, she felt awful going home, but she coped. And she just wants to be like everybody else. And there's a 30-day trek program as opposed to 10 for her to do next year, which her sister's now doing at the moment. And we're trying to work through OEG to see if that's feasible, because they have 2 days of solo where they're by themselves and they read diaries and reflect and stuff like that. And she's saying no modification, and I'm going to do it, and I'm going to be like everybody else. So we're working through that not only with the school but with the education group, the outdoor education group, and I'm scared shitless.
Yeah, there obviously needs to be realistic, you know, goals put in place, and, you know, of safety comes first, 100%, but that doesn't mean that you can miss out completely. So hopefully if there's a plan put in place that everyone feels comfortable with, then, you know, that will still happen. But yeah, safety is number one.
And definitely look at those guidelines. They're really, really interesting. It puts out about camps. So I was going to say, I know we've got one question here. Adriana, because Adriana hasn't got much more time left with us, if you have any direct questions to her, I'm happy to talk about schools and stuff to what I know after. But if you've got any psychology-related questions, that would be great coming to Adriana.
It's not about camps, but my daughter is 15 and is looking for a part-time job. At what point do you tell the employer that she has Type 1? At the interview, or do you wait till she's got the job?
That's a really interesting question.
Good question.
Do you have to tell the employer that she has Type 1 diabetes?
I would think you would have to, but then I think that would probably deter them from employing you. I'd tell them after she got the job. After she got it. Because they shouldn't discriminate against her at the interview.
Discrimination is a big problem.
Who tells them? She does. She tells them. Yeah. On her first day. Do it before. Yeah.
Do you mind if I give you a fee experience? Is that all right? I've just lived with Type 1 for 30 years, clocking over. So I've done that part-time job, and now I'm a nurse as well, or a diabetes educator, which you don't really have to disclose it when you have diabetes as a diabetes educator. So that's kind of cool. I never let anybody know while I was going through that whole process. But what I did do, and what I tell our kids at work, Adriana, see what you think about this, is to actually, when they ask them a problem-solving question, not to disclose they have diabetes, but use one of those things that's come up, because our kids are the best problem solvers and are so resilient. So they can actually use their diabetes to get a job without anyone knowing. So that's a really good point. Or experience, use experience. But as far as telling someone, most jobs you have to fill out a medical form once you have it. That's where you disclose you have Type 1 diabetes.
Yeah.
But where I work, we have to fill out that before the medical. So before the job is offered, they have the medical, where you would have to disclose it.
Yeah, and in that case, I'm pretty sure we have to if you're filling in a medical, you have to disclose.
You don't tell.
Yeah, no, exactly right. And I must admit, now you've said that, actually all my nursing jobs I've filled out a medical first and write Type 1.
Yeah, so it depends on where you're working, obviously. It's the individual choice. They feel comfortable. Is it going to impact on her ability to work in that job? She's 15, so she can probably do that herself if she feels comfortable doing that. But she shouldn't necessarily be forced to do it because it's, she might be fine without having to tell them. Yeah.
Adriana, what we find with the kids in part-time jobs is if they don't tell them, then we have problems with them not checking if they feel low and not having hypo food.
That's true.
Because they can't get. So that's one of the things just to be aware.
That happens with adults too. So it's,
absolutely.
There's a lot. Discrimination does happen in workplaces. Even among adults, we hear it a lot, and so that can be a deterrent for taking a break if they need to and that kind of thing. So if they feel comfortable telling them, then it probably is a good idea. If they feel that their employer is understanding that they may need to sit down, if they have a hypo or something like that, and to have, someone to call if things did become severe in, that unlikely event. But I suppose it's, really up to them to suss that out, I suppose. Yeah.
Look, everyone, thank you so very much for staying back. I think you've just given JDRF another topic for next year, and I think that might be schools, actually.
I think so.
Thank you so very much for your time. Adriana, once again, thank you for being so generous with your time as well.
Thank you. Thanks to everyone for sharing as well.
Well done for that camp. That's awesome.
Oh, thanks so much for your time.